Rolling.
Hi, my name is Brian. I'm with San Joaquin Community Hospital. We're a community school here to show you how to suction an individual. Cool thing about this is you don't need a doctor's order to do it, so let's hurry up and get down. First thing you want to do is auscultate the patient's chest, find out if there's a need for suctioning to begin with. Inspiratory, expiratory wheezes, that sounds indicative for good suctioning. First thing you want to do is gather equipment. Unfortunately, or fortunately, this patient's already intubated, so we don't need. But if you did, you have an 8-inch suction catheter here that has some gloves and the necessary utensils to go down deep and get whatever you need to get out. In the meanwhile, you can have somebody set up a suction device, set it up to -100 to 120 for the adults. Got some gloves, got some suction catheters here going on with some other little trays and individuals to suction. But our patient happens to be intubated, so we don't need none of that. But we do need the -180 or -120 suction deal. So what you want to do is you want to pre-oxygenate the patient with 100% O2 for approximately 1 to 2 minutes before you start suctioning. Once that's done, make sure the pulse ox reading is good, and then all of a sudden you advance the catheter down into the patient's ET tube until you meet resistance. Once you meet resistance, you pull it out just a little bit. Make sure that this isn't in a locked position and hook to the equipment. Push down on the equipment and slowly pull out for 15 seconds, no more than. Once you get done with the oxygenation of the patient and suctioning, you want to go ahead and you want to return the equipment back to the normal position. You want to re-oxygenate the patient for at least 1 to 2 minutes at 100% oxygen until the patient's stats comes back up. You're going to return the vent settings to the original settings they were on before you started doing the suctioning. You want to go ahead and clean your equipment that you have, clean the patient up, get ready for the family to come in, step outside the room, and then chart the information like you just did. And that concludes this presentation on how to suction an individual, brought to you by Brian Martin, San Joaquin Hospital, School. Thanks.
Woo!